Just after 3 days of manipulation and anesthesia with my patients, with lumbar herniations, cervical herniations, any type of radicular pain going down the upper or lower extremity, I found phenomenal results in the realm of increase of range of motion, decrease in pain, decrease in adhesions, so the restriction is lessened tremendously. Phenomenal results. I would love to help you and or a family member. Please come in and find out if you're a candidate for manipulation under anesthesia. Patient's been with me for a handful of months. Conservative chiropractic care for about 4 to 6 weeks. L5, S1 disc herniation, right S1 nerve root is encroached. Bilateral scapular adhesions, adhesive capsulitis, especially on the left glenohumeral joint in the scapular region. C4, C5 in his neck, phase 1 degeneration, so it's really hitting his levators, rhomboids, and his deltoid. So, you know, full spine gamut. Right leg is the one that's really been encroached on that S1 nerve root. Okay. Patient presented with L5 S1 herniation, which is predominantly about 90% of most offices, and radicular pain going down the right side continuously. C4, C5, bulging disc in the neck as well. Radiculitis going down the left arm. Adhesive capsulitis, which means frozen shoulder in both shoulders, mainly restricted in the left, a failed surgery about 9 months ago, and interscapular adhesions between the shoulder blades as well. And the procedure went perfect. Couldn't ask for better.
Chad, how are you feeling now?
Dizzy.
Yeah. How about your arms?
It's less impinging, I guess you could say. The main thing that was here.
Right.
My neck seems to have some motion and movement, so.
And you're gonna be back for
tomorrow and then Saturday, yes. Yeah. Well, he said he was pretty surprised at the movements I was able to make.
Yeah.
So.
That's good.
Patient presented with L5 herniation in the low back, radicular pain going down the right leg, shoulder surgery on the labrum and the capsule 9 months ago?
Yeah.
About 9-10 months ago. Shoulder restriction on both sides, mainly the left one. How are you feeling today? 1 to a 10, 10 being the worst.
3 to 4.
3 to 4. How much pain going down the leg?
None.
None going down the leg? Localizing the butt cheek, localizing the low back?
It's a little bit. I know it's there, up in the
the butt cheek?
Yeah.
Up in the butt cheek. So 1 to a 10, 10 being the worst as far as this leg. How you feeling?
2, 3.
2. 70% reduction in one visit. Today is day 2, so we're very excited to get him in for the next 2 days and see how he feels tomorrow morning. Thanks. Wow, what a difference. There it is. From yesterday, patient presents 70% better range of motion on day 2 alone. Today's adhesions were diminished by 60-70%, so the entire procedure went not only smoother, but it was easier for the patient as well as for us. And I'm very excited about day number 3 to see how much better he feels, because the radicular pain went down by 70% in one visit. Thanks. Chad, this is our third day of MUAs on Chad. L5, S1, disc herniation, encroaching on the right nerve root. It's been traveling down his right leg, diminished by a solid 85 to 90% on day 3. C4, C5, annular bulge in the neck, causing a lot of interscapular adhesions, extreme left shoulder pain. He had shoulder surgery about 9-10 months ago. No rotator cuffs involved, little labral tear, and that's resolved by a solid 70%. 1 to a 10, 10 being the worst on the shoulder. What is it today?
3, 4.
3-4 in the shoulder, so marked improvement by 70 to 65%, and then in the left leg and the left hip, in the right hip, how much has it decreased?
It's decreased a lot. I'd say it's probably about 2, 3.
About a 2. So today on the third day, we're going to release his anterior pelvis again, both SI joints, as well as increase the range of motion of both shoulders. Can you pull down? Traction. Increased by 85%. Joint play is definitely increased. Adhesions in the left scapular region decreased. Mild to 0. Day 3 of MUA with Chad. Huge difference in the low back. No radiculitis down the leg. 90-95% improvement on range of motion alone in the low back. The disc decompression on L5-S1, disc herniation, phenomenal. The left shoulder adhesions, marked difference. Decreased by at least 90%. Range of motions increased by 100%. Overall, it was a very successful 3-day with Chad. Thanks. Very pleased.
Coming to see Dr. Cielo was every morning I'd wake up, my right arm would be numb. Been to neurologists, they couldn't find anything. And then also had the same feeling down my right leg, down my hip, numbness. And come to find out I had herniations in my neck and my lower back. During the 3 days of the MUA, I felt 100% better. 100% better after day 3, especially. No more pain running down the leg and the numbness. My arm, I haven't woken up a day feeling numb. It used to wake me up before my alarm did, so it's better, a lot better. My range of motion is definitely better. I noticed it right away. When I would wake up in the morning, bending down and put my shoes on, it was easy. It didn't hurt. And just flexibility overall is honestly much better. After the MUA, I no longer have had any numbness running down my leg or numbness in my arm. Overall, I'm very pleased with the MUA as to this point. Yes, very satisfied.